Warfarin is an anticoagulant, sometimes also known as a blood thinner. It prevents harmful blood clots from forming in your heart and blood vessels and getting stuck elsewhere, such as the brain, lungs, or legs. It does not dissolve existing clots, but prevents clots from becoming larger. It reduces the risk of events such as a stroke or heart attack, which can happen due to the formation of blood clots. Warfarin may be prescribed if you have existing clots in the lungs, veins, arteries, or heart, irregular heart rhythm, heart valve replacements, blood disorders that result in increased tendency to form clots or stroke. It may also be used to reduce the clotting ability of your blood to prevent further complications. The length of treatment may range from a few weeks to long-term, depending on what your doctor has prescribed it for. The most common brand available in Singapore is Maravan. There are 3 colors and strengths: 1 milligram, which is brown, 3 milligram, which is blue, and 5 milligram, which is pink in color. Do not change the brand of Warfarin on your own, as they may have slightly different effectiveness. You may take this medication with or without food. You should take Warfarin once a day at the same time each day. Do not miss, double, or adjust your dose unless directed by your doctor or pharmacist. Do not stop taking your medication without checking with your healthcare professional. If you do happen to miss a dose, take the missed dose as soon as you remember if it is within 8 hours of your usual time to take Warfarin. If it is after 8 hours, skip the dose for that day and take your Warfarin dose at the usual time the next day. Do not double your dose unless your doctor or pharmacist tells you to, as this can cause excessive bleeding. Record all missed doses and dates and inform your doctor or pharmacist at your next appointment. Some common side effects may include bleeding gums when brushing teeth. Use a soft toothbrush and floss gently. You may experience unexplained nosebleeds or bleeding from minor cuts or injury that does not stop within 10 to 15 minutes. Use an electric shaver instead of a blade while shaving and seek medical attention immediately if bleeding does not stop within 15 minutes, even when pressure is applied. Excessive menstrual bleeding may occur in women. Increased menstrual flow is common for women, but check with your doctor if you develop signs and symptoms of low blood count, which include feeling very tired and weak, having shortness of breath, loss of appetite, having pale or yellowish skin, giddiness, and experiencing chest pain. Very rarely, this medication can cause internal bleeding. Symptoms include black, sticky, or bloody stools, coughing up blood or coffee ground like vomit, having unexplained bruises or purple areas on your skin, blood in your urine, experiencing a confusion that happens quickly and suddenly, a severe headache that does not go away with nausea, loss of consciousness, or giddiness. Stop this medication and see a doctor immediately if you notice any of these symptoms. Maintain a consistent diet in terms of your daily portions of vitamin K-rich food to ensure consistency in vitamin K intake. Some examples of food rich in vitamin K include avocado, broccoli, Brussels sprouts, cabbage, spinach, and green tea. It is not necessary to avoid these foods entirely, but consume them consistently in terms of frequency and portion size. Avoid any form of traditional or herbal remedies such as ginseng soup, herbal bak kut teh, or herbal jelly. Avoid taking cranberry or grapefruit in large amounts, as these may affect the warfarin level in the body. Avoid excessive alcohol consumption. It is advisable to take no more than 1 can or glass of beer or wine per day. Avoid strong alcoholic drinks such as whiskey or brandy, as this can cause changes to the effect of warfarin. Many medications can affect the way warfarin works in your body. Consult your doctor or pharmacist before you start, stop, or change the dose of your medications. If there are any supplements that you are keen to start or change, consult your doctor or pharmacist as well. you may need to have more frequent monitoring on the effect of warfarin. The dose of warfarin varies among individuals, and the dose you require depends on a blood test known as the International Normalized Ratio, also known as INR. This measures how long your blood takes to clot, and your doctor will set a target range for you. If your INR is below target, this means your blood may be thicker than desired, which means a higher risk of clotting. If your INR is above target, this means your blood may be thinner than desired, which means a higher risk of bleeding. You will need closer monitoring of the INR blood tests if you are newly started on warfarin or had a recent change in your warfarin dosage. Blood clots may still form while you are taking warfarin. The signs and symptoms depend on the site where they are found. See a doctor immediately or go to the hospital if you experience any of the following: symptoms of deep vein thrombosis, such as swelling, redness, pain, warmth, or numbness in your leg. Symptoms of pulmonary embolism, such as chest pain, shortness of breath, or coughing up blood. Symptoms of stroke, such as having muscle weakness, difficulty talking, blackouts, giddiness, experiencing blurred vision. There is no need to make drastic changes to your lifestyle. However, avoid sports or activities that may cause you to get injured. See a doctor if you have any fall or injury to any part of your body. Inform all doctors, dentists, and pharmacists that you are on warfarin. There may be a need to stop the medication for a short period of time if you are going for any surgical procedures or dental treatment.